What is heart attack? Heart attack is a medical emergency which develops because of blockage of a blood vessel. So normally heart has what are known as coronary arteries which supply blood to the heart muscle. So heart, for it to function normally, it needs nourishment, and this nourishment and also the oxygen supply to the heart muscle is given by blood vessels called coronary arteries. So there are three important coronary arteries. On the left side we have two, and on the right side we have one. So these three arteries completely supply the heart muscle continuously with oxygen and nutrients. If by chance if one of the arteries gets blocked suddenly, abruptly, the blood flow through the vessel to the heart muscle is cut off. So when the blood supply is cut off, the supply of oxygen and nutrients to the heart muscle suffers. So an acute suffering of heart muscle because of lack of oxygen and nutrients leads to a heart attack. This is typically manifests with a chest pain which is felt in the middle of the chest, or it can radiate to the lower jaw or into the upper abdomen. Sometimes this pain can radiate into the left arm. So when somebody gets a pain in the middle of the chest or in the lower jaw or in the upper abdomen without a reason, suddenly, abruptly, and if it is persisting for more than 5 to 10 minutes, this symptom should be taken as a symptom of or a warning of a heart attack. So individuals who develop heart attack tend to develop associated symptoms like breathlessness, palpitations, sweatings, and a vague feeling of uneasiness or fatigue. So in certain individuals, the typical pain and the symptoms of whatever we discussed, the typical pain of in the mid precardium, that is in the middle of the chest, doesn't develop all the time. So some people can have only a sudden breathlessness or a vague palpitations or a vague discomfort in the chest or some kind of a burning in the chest. These also should be taken as a sign of heart attack if it is persisting for more than 5 minutes. So individuals who experience these should immediately report to the nearest medical facility, and the diagnosis is made with the help of an electrocardiogram and also by the history. And once the diagnosis of heart attack is made, it is not that all heart attacks would lead to some serious issues like cardiac arrest or something like that. Most of the heart attacks, when they are recognized early, they can be treated very effectively and easily. There are now medications. The medications are given at the time of presentation to the hospital itself. These medications are given, and once they are given, the blood vessel opens up. Sometimes injections which lies the clot which is formed in the blood vessel are given to effectively open the vessel and restore the blood supply so that the heart attack can be stopped. Or sometimes individual goes to a hospital where there is an angioplasty procedure possibility. That's the best that can be done, and anybody having a heart attack going to a hospital with angioplasty availability is there in the hospital where he goes. That hospital performs the angioplasty, the maximum heart muscle can be saved instead of giving the blood thinning injection, which is called the thrombolytic. So studies have shown that the people who undergo angioplasty, which is called primary angioplasty in heart attack, they fare better than the people who receive just a drug which is called thrombolytic. So whenever heart attack happens, it is or a doubtful heart attack happens, it is very essential that you seek attention from hospital and get an ECG done and get the treatment, proper treatment, so that the heart muscle can be salvaged. So ineffective treatment or not receiving the proper treatment can be dangerous in the long run, because once the heart attack happens, heart muscle dies. And if the heart muscle dies and permanently if it is damaged, there is no way the heart muscle can be restored back. So it's very essential that whenever there is a doubt, the earlier the attention, medical attention is sought after, and when earlier the problem is addressed, the better it is for the individual. So heart attack is nothing like as a fatal incident all the time. Sometimes it can be treated very effectively, very easily with the kind of available facilities that we have nowadays with primary angioplasty and drugs.